all your names and everyone on here. I'm going to be going through a presentation. And of course, if you have any questions, please stop me throughout. There is a chat, I believe, so that you can type in questions there. And if I don't see it, I know someone else that's just as qualified will answer it for you. And there is a Q&A section later this evening, so there will be other students joining on, so they'll be able to answer your questions. But please feel free to interrupt me if you want any clarification. But we're going to start off here just talking about basically who PAs are, what we do, so you can get a general idea of what the PA career is like if you're interested in becoming a PA. And we're going to start off just by talking a little bit about the history. So what is a physician assistant? So a PA is a medical professional that works as part of a healthcare team with a physician. They are graduates of an accredited PA program and nationally certified and state licensed to practice medicine. I think this might be cut off a little bit. I'm not sure why exactly. Is it cut off for anyone else as well?
Yeah, it is cut off, Esther. That's
Huh.
okay.
Okay. Not sure why it's cut off. It wasn't cut off for me earlier. I don't know if it's because it converted weird. I'll just keep going, but if it becomes too much of a bother, we can always try to troubleshoot it. But I just want to stop here and mention specifically accredited PA programs. What that's referring to is that all the PA programs in the United States are accredited and certified by a national organization called ARC-PA. And so every 5 years, they make sure that all the PA programs are adhering to a certain standard of quality so that the PA students are meeting the required minimum, um, standards so that they can, once they graduate, they'll be fully functioning PAs and they're meeting the standard across the entire nation. So when you are researching PA programs, it's really important to make sure to see at what level they are. You might see that they are provisionally accredited, so that just means that they are in the process of becoming fully accredited. So that typically refers to them being a new program. You might also see that they are continued accreditation. So that's what you normally see. That just means they have been recently accredited by and approved by ARC-PA. Otherwise, sometimes you might see a program is on probation. So that just means in their most recent site visit, they have some things to update and they need to work towards that requirement so that they can get back to their continued accreditation status. So most recently, my program, I'm from Shenandoah University. We just had our accreditation very coincidentally last Monday, I think. So when you are researching PA programs, it's important to see where they are in that process because you might be less inclined to apply to a program if it's on probation because you don't really, it's not ideal for you to graduate from a program on probation because that might hinder your job opportunities in the future. And you want to make sure that you are hitting that standard that another PA student will be getting at a different school. And what they mean by nationally certified, once you graduate PA school, you do take a national certifying exam. It's called the PANCE. And so that exam you have to take once you graduate so that you can actually practice. And you do have to retake a certifying exam, I believe, every 10 years or so. So you are required to continuously, educate yourself and get a certain number of hours of, they're called CME credits, but essentially you have to show that you are continuously trying to improve yourself and meeting that minimum standard. So even if you are in one specialty, let's say you are in dermatology, you still know the basics of, primary care that are required for you to pass that recertification exam. And of course, you obviously have to pass a state license exam as well, kind of like how, doctors, lawyers, or other, professionals in society need as well. So like I mentioned, we're just going to briefly go over a timeline of the PA history and how we came to be. So this roughly started in the mid to late 1900s, specifically, after World War II, because they noticed there was a big shortage of healthcare workers in primary care. So in the 1960s, you have health services, what they deemed as, their normal was delivered by private physicians. And then also you had your nurses and then the MDs that were physically there on site with, other private MDs to care for their own patients. And then 1965, you'll hear his name a lot if you get into PA school because you do have to take a class, I think, to learn more about the history. But Dr. Eugene Steed announced the nation's first PA program at Duke University, which is still a PA program that's highly respected today. And the program accepted four former Navy corpsmen. So back then, like I said, there was a big shortage in the primary care field, and they noticed that a lot of these military corpsmen were already kind of pre-trained and that they had some medical training. So they would actually they considered that an advantage. So since they already had some training, they were able to use that experience because they had a kind of had a head start at school already. And so Dr. Eugene Stead Jr. announced his intention to develop a program for the PAs in a letter to Duke Hospital. The program would utilize former military corpsmen, like I said, and would be modeled after that relationship between an MD and an assistant team that's well known in the North Carolina community. So I think when the program first started at Duke, kind of like today, it was about a 2-year program. However, it was a bachelor's program. So nowadays, you'll see that all PA programs, I think since maybe 2021, I read earlier, are now all master's programs. So, after you finish undergraduate, your education, then you'll move on to graduate schooling. So a lot of these PA programs, are typically average around 2 to 3 years, but they are now all master's programs, you'll notice. In terms of what PAs do, so kind of like other medical professionals, we are expected to diagnose and manage diseases. So that includes chronic illnesses as well. And prescribing medication is obviously a really important factor, and that can depend on the state as well as to what degree. So some certain states have regulations on controlled substances. So I'm not particularly sure what Virginia's is, but there are some limits in that compared to, what you may see a physician do. But in general, all medications we are expected and to prescribe, and that we have the ability to do so. We also perform minor surgeries, and that can be something just as simple as, like a biopsy for like a skin lesion in a dermatology office. So just, not even like a 2-minute quick procedure. Or it could be something more, you might see that they're closing up a wound with like sutures in an ER. And they monitor and manage hospital inpatients as well. And then major surgeries is also pretty common as well. So I recently had the opportunity to see a PA who's been practicing for over 20 years, and she and the surgeon that she works with in an orthopedic surgeon's office twice a week. She's in the OR with her physician, and she is in there with the knee replacements, shoulder replacements. She is there being his first assist. So she's the one who's suturing up the wound at the very end of the procedure, cleaning it up, but she's also there helping to clean up the area to make sure he can see the area in question and help him with that. So major surgeries is pretty common. It just, once again, depends on the specialty that you go into and the practice in terms of how much responsibility they're willing to give you from the very beginning. In terms of what other things PAs can do, so obviously ordering and interpreting lab results is pretty important when you're helping to work up a patient for a diagnosis. Performing physical exams goes right in hand with that, and obtaining medical histories is something that you'll be getting very comfortable with when you're in PA school. And obviously, educating patients on treatment and health maintenance is, a requirement after the end of each visit. And these are all skills that you will become familiar with during PA school. They really hammer in the basics of obtaining medical histories, even though that's not something you always see day in, day out. When you go to a doctor's office, you might see that, the nurse or the medical assistant's the one that's getting the medical history, but you are expected to know how to do and take a proficient medical history as a PA because it's still a very important skill and something that, will help you even if someone had done it before you, because there's always additional questions that you could ask and can really help you when you're trying to talk to your patient and, get to know them better and bond with them. So these are all qualities that are very important for a new PA, but also a PA that, like I said, has been practicing for well over 20 years. In terms of more of a kind of general statistics about who certified PAs are, so currently in the US, we have over 148,000 certified PAs. And in terms of makeup, you can see a large majority of PAs are about in the 30 to 39 age range. And, you still have some PAs that are practicing above the age of 60, but primarily you'll see that a lot of the majority of PAs are primarily, in the 30s to 40s-ish. And you'll see that the overwhelming majority are females, and you normally see that in PA schools as well. A lot of programs have a wide majority of female students. And in terms of race, you'll see that there is a big need for PAs in terms of diversity so that we can actually match the demographic of the country so that we can make sure that we're filling the gap so that the patients who are being treated, we look like them, we know their experiences, we know where we're coming from, because sometimes you need that person and that cultural connection so that you feel like you're not alone, because it's already scary a lot for these patients to come into a medical appointment when they're already hesitant to be treated for something or when they're scared. So sometimes seeing someone like you can really help to bridge that gap. And, that's why a lot of these programs really highlight diversity in their mission statements and their goals. And you can see which programs highlight that more when you go on to their website. You can see which schools have that specific goal. And if you're invited to an interview, I highly recommend you asking about how they implement that goal or how they try to strive to succeed that. Because most of the time they have specific things in mind and protocols and classes and professors address that specifically throughout whether that be through the clinical curriculum or whether it's through outside school events so that, you feel included, you feel seen, and that that even though your diversity in your class might not reflect it, they're really trying to make sure to bridge that gap. So that's something that's always really important to look out for when you are researching schools. And more statistics on PAs. So average number of hours worked by PAs is roughly 40 hours, and they typically see about 73 patients each week. And the average salary is roughly 110,000 for certified PAs in the US. And there's clearly, going to be some variety with that depending on how many years of experience you might have, but also where you are location-wise. So I believe in Virginia, I actually had a discussion with a professor about this just last week. I think starting salary, so, after you graduate your 2 to 3 years of PA school in Virginia, is actually roughly this number. I think we said it was 109,000, I believe. And obviously that's a pretty big factor for why some people are more inclined to become a PA, because, you only have 2 to 3 years of education and your starting salary is already six figures. But just keep in mind, this number can fluctuate a little bit, like I said, depending on whether you're part-time or full-time. And also, I know particularly Northern Virginia has higher, it costs a lot to live here. So therefore, the salary tends to be higher as well. But if you're in a rural area, that salary might not be as high when you first start out. But typically, that's the number you should expect. And if you're really curious, what you can do is if you go on, like your typical job site, like Indeed, and look up physician assistant, you can generally see the salary of what a starting PA might start out with, or even an experienced PA, just so you can get a general idea of your specific area that you're looking to stay in when you start practicing. They give you a general idea of how much a PA will make around that range. In terms of specific specialties, so PAs are practiced in every medical specialty. I'm not going to read out every single one of these, but there's just a very wide range of what specialty you can go into. Clearly, you can see that primary care is the very most popular, and that's kind of like what we mentioned earlier. It's because the original goal of PAs was to fill the gap for primary care providers. So that's the original goal, and that's kind of continued throughout and been consistent. So you might even see a lot of PA schools in their mission goals. Their primary purpose is to have PA students graduate and go into primary care because they want to honor that original mindset of why PAs became PAs. So I don't want to harp on my program too much, but Shenandoah University is one of those PAs or one of those PA programs where they really like and try and emphasize primary care to their students. So you'll see a lot of that throughout the curriculum, and they try and incorporate that as well when you go into rotations. Otherwise, you'll see that family medicine and general practice are also popular specialties to go into, as well as emergency medicine, which, also has a great need for medical providers, and also internal medicine. And you can see some of those other specialties listed here on the slide, but there truly is no specialty PAs are not in. I know that, you might see a PA in like pediatric oncology or even interventional radiology, which is, very specialized, or even like plastic surgery. We might not initially think that PAs would be in, but I think after talking with one of my previous preceptors, she did note that it was typically on average a PA is in a specialty for roughly 7 years. So even if you start out in primary care, get a good foundation of all your medical knowledge, that doesn't necessarily mean that you are expected to be in primary care for the rest of your career. There is some movement within specialties so that you can switch to maybe a very subspecialized area, or you can remain in that field as well. There's no one saying that you have to or you can't move, but just know that there's a wide variety of specialties. And kind of like what I said earlier, if you truly are curious about what specialties that PAs could be in that maybe you didn't even know was an option, you could always look up, potential like jobs, not that you'd be applying right now, but just to see what there is a need for in your area, but also what kind of opportunities they are for these really specialized areas. So kind of going back to where these PAs and these specialties would practice, you see a large majority of them are in hospitals, particularly in Virginia. I'm sure everyone has seen Inova is a very large employer of PAs. And then you also see office-based private practices, the ones that are non-affiliated with those big hospital institutions. Federal government facilities are also pretty important. You'll see that students will often have rotation in with the VAs. So you will see them there and PAs practicing there. I also know that there are opportunities for PAs to be employed with the State Department, and they are always actively recruiting. So working for the State Department means that you will be sent abroad to a country. For instance, I think Vietnam's one of the more popular ones, and you will be at their military base in the State Department treating the families of the foreign officials there and U.S. Workers. So that's always an option too. If you're more curious about that, I know they're always recruiting, so you can go on the website to look at that. Otherwise, urgent care and community health centers are also different areas that PAs can practice. In terms of states, you'll see that New York, California, Pennsylvania, Texas, and Florida make up the most area of where PAs work. And it's not really of a coincidence, but Pennsylvania, I believe, has the most amount of PA programs in the country. And second to them is New York. And obviously, these states here are very highly populated, so it makes sense they would have a lot of PAs. But keep in mind, you still have rural areas even within New York and Pennsylvania, also Texas and Florida. So even though you might associate them with these highly, like populated cities like, New York City or even like Pittsburgh or Philadelphia, PAs are still practicing out in these rural areas, which goes back to the need for them to fill in the gap where there might be a shortage of medical workers. So they're trying to help relieve and shoulder the burden so that not these patients are traveling miles to, go into the big city and having really long appointment times to see that one medical provider who's in that one specific specialty. Being in those rural areas can really help offset that burden so that these patients don't have to travel far or spend a lot of money. And this is the part where you guys are probably the most interested in, but how to actually become a PA. So it all starts kind of what I mentioned earlier by researching PA programs. And it never hurts to research early because things constantly change. You'll notice that schools will change their requirements, their prerequisites primarily, not on a year-to-year basis, but more so than you would think. So even when I applied to my PA program versus now, it's been less than 2 years and already their prerequisites have changed. So if I want to apply again, I might have to reassess, what classes I've taken. So like I said, even before entering undergraduate, it's a good idea to research PA programs to get a sense of those courses that you'd be required to take. And of course, that's going to depend on the specific program and also just making sure that your course specifically aligns with the requirements of that course. So for example, I know that some schools, offer like animal, like anatomy. That's not going to apply over to the anatomic or an anatomy requirement that PA schools have for actual humans. Obtaining a bachelor's degree is obviously really important because that is the degree that you will need to actually apply, and that's from an accredited college or university. And it's not necessarily a requirement, but having a science-related major really does help because you can tick, 2 boxes. You are fulfilling your degree requirements to actually graduate your university, but at the same time, you are fulfilling the requirement to get that prerequisite class for the PA school. So for instance, if you had a major in like fine arts performance, You might find that you're really busy trying to graduate with your arts degree, but then at the same time, you have to find time within your schedule and your courses and your credits to, get that microbiome lab in. So that might be a little more difficult to juggle if you are doing a non-science related major, but I'm not saying it's impossible. And it definitely makes you stand out within the actual program itself to show that you were able to do both and that you have experience in a different degree area. And getting healthcare hours and patient care experience is absolutely vital to, consider coming into PA school. So typically the general requirement is roughly about 1,000 hours. I know some schools have dropped this down to 500 and some programs don't even require it at all. Like I said, it's truly program dependent, which is why the research aspect is so, so very important because those numbers can change. They might go up, they might go down, but also it depends on the quality of experience as well, you can say. So, working at a front desk isn't really the same as actually being a medical assistant and working in the back with the PAs or the physicians or nurse practitioners and actually interacting with the patients. And it might be a better idea for you to get those hours earlier than later. I think a lot of people, what they do is they try and work during the summers to fulfill their 1,000 hours before they start applying. So that way they can hit the ground running and they don't have to take multiple gap years. And I would like to preface by saying taking a gap year is not necessarily a bad idea or it shouldn't be frowned upon. I personally took a gap year and I wasn't necessarily expecting it, but it does truly give you the time you need to get those hours. And it will help you when you get into PA school because it might seem tedious in the beginning that you're constantly trying to meet this hour requirement. But when you get to PA school, you'll truly realize those hours came in handy because all those patient interactions you've had and moments where you've learned something from a patient's experience or even just from the healthcare provider you worked with, it does apply in PA school and it helps you remember things or just understand things better. So continuing on, obviously the next step would be to actually apply to PA school once you've graduated and obtained that number of patient care hours. And as a part of the application process, kind of like with any graduate school, you'll have to share transcripts, letters of recommendations, and the evidence of you having your hours. And many, many PA programs will actually require an interview after they received your application. And so those letters of recommendations, there's not some PA programs have a specific requirement. Some of them will require that you shadow with a PA and they might want a letter from that PA. It could be from someone that you've worked under or even a close professor you've had. So I'm sure if you haven't already, the program that you use to apply to PA schools is called CASPA. So they will lay out all the things that you'll need from each school so that you won't get too mixed up here. But that's another reason why these patient care hours are very important because you'll be forming relationships with the people that you work with, and they will be the ones vouching for you when you apply to PA school. So it's important early on to form those relationships, but also just let them know that you are applying to PA school, just so that they are aware that, that's what your goal is. And there might come a time where you need them to help you out to reach that goal. And then, the big, big goal here is to complete PA school. So once you have finished school, which is roughly, about 2 to 3 years, 23 to 27 months, this is the point where you are going to be studying to complete or to graduate and then actually pass the certifying exam that I mentioned earlier, the PANCE. And it says prior to graduating, you'll need to complete at least 2,000 hours of structured clinical education. And that's not necessarily something that you have to, keep track of the hours for. That's something the program takes care of when they are creating your curriculum with didactic portion of you being in the classroom, but also, more importantly, you being out in clinical rotations and fulfilling the requirements of being in those specific fields and getting the right number of hours for each area. And passing the PANCE, like I mentioned, is, the end goal of all of this for you to actually start, entering the work field and treating patients. And once you pass that and, you have your state license, you are now technically a PAC. And this is a stat that you'll see pretty commonly because it's, a really good stat. The US News and World Report ranks PAs as the #1 best job in 2021 and #1 of the top 100 best healthcare jobs. And this is another really good motivator for people to become PAs because it's really hard as if you have had any healthcare experience. It's really hard to juggle, work-life balance. But PAs, you'll often hear, are able to do this comfortably and happily because of, how the responsibilities they have, but also just because of the support they have from their workplaces. So this will really contribute a lot to, what you'll see as the number one best job, because you don't have as much student debt as you would see a doctor would have, because schooling is roughly 2 to 3 years. You are able to start with six figures right off the bat, right after you graduate. And there's a lot of flexibility as well because you can switch between specialties, need be. If you don't like the specialty that you work in, or if you want to expand your horizon and change something because you want to learn more in a different area, that's more than possible, which is not something a doctor can do. And there's also some flexibility in where you get to practice as well. If you've read any recent headlines, you'll see that there is a PA state compact for licensure. So there are a certain number of states right now, I believe Virginia is one of them, where they are coming to an agreement where PAs can practice in, for example, let's say Washington State. Um, Even though the Virginia PA may not have a PA state license of Washington, they have come to an agreement where that the Virginia PA can practice in Washington PA because of that compact licensure. So that's something you might see become more and more relevant since more and more states are joining this compact. But that's another reason why you'll find a lot of flexibility within the PA field that you might not see with other healthcare professions. And why you should become a certified PA. I'm sure you guys are already motivated to become a certified PA, otherwise you wouldn't be here. But as you can kind of tell throughout the presentation, the general theme is there is years even after the first PA program was developed, there is still a shortage. You see, with the rising age of the American population, more and more PAs are needed to fill that gap so that we can have more healthcare professionals in primary care, but also other specialties as well, because we want to make sure that each patient has a provider that they don't have to wait, 6 months to see, because we're booking out so far ahead, or, you're seeing these like patients that are traveling hours and miles and spending money out of pocket because they have no other choice when they need to see someone right at that moment. So, the medical field desperately needs more people to step up to help make sure that patients are all being seen. And flexibility, as I mentioned, is a great, great aspect to it because that work-life balance is something that will carry on throughout the entire career and something that you would like to have, I'm sure, if you're in struggling to decide between PAs versus a different specialty or different healthcare field. This is one of the largest points that you will hear over and over again that PAs with experience will cite as one of the reasons why they love their jobs so much. Otherwise, job outlook. So employment of PAs is projected to grow 31% between 2019 and 2029, and that's faster than average for all occupations. And job satisfaction, we, as I said, constantly rate as one of the top jobs in healthcare. And so job outlook, you might notice, is becoming quite high with that percentage. And there's a lot of PA programs too. There have been an increase in PA programs in recent years. And, like I said, some of them might be provisional, so they're new and they're looking to get fully accredited. Otherwise, you'll see that continued accredited programs are looking to try and expand the number of students they can admit each year. So that's something to keep an eye on, especially within your area. If you're saying there's not a lot of PA programs by you, you might notice that, for instance, my program, once again, the primary campus is in Winchester, Virginia, but I believe it was past 2015, they opened up a campus in Loudoun, which is where I am. So that's in Northern Virginia. So if you keep an eye on that, you'll see that a lot of programs are trying to expand because there are, it's associated with the rise in need of PAs in the country. So almost 150,000 certified PAs have, joined this call so that they can help the patients need across the country. So highly, highly asking you guys to consider this career, not only for yourself for the work-life balance, but also for the patients that desperately need you as the age of the demographic increases. And of course, here is more information about the profession. So you'll see that AAPA, that's the National Organization for Physician Assistants. They have a lot more information on their website about the history of PAs. And also they have some specific sites, I think, about for pre-PA students if you're interested in that. PA History Society, like I said, also goes into more depth about the PA history if you're interested in that. And NCCPA is the one who, you can see in the corner here, helped with the presentation. And PAs Do That is also a great resource if you're curious more about learning about the profession and what they do on a daily basis. Sorry, I feel like I went through that really quickly, but I know a lot of people are expecting a lot from the Q&A session. But do you guys have any questions from the presentation that I just went through that I could answer? And you can use the chat or you can, just verbally speak if whatever works for you.
So Esther, I'll chime in here. We do have a question in the Q&A. So just to let you know, I think the chat function is disabled for the
Oh,
attendees,
okay.
but the attendees can submit questions through the Q&A. So if you look down at the bottom, you should see that Q&A down there. So you can submit some questions there. But we do have a question here. And the question is there a good first job that you would recommend for someone who hasn't worked and gotten any hours yet? This is related to patient care or healthcare experience.
Okay. That honestly is a good question, and I know that's what's on a lot of people's minds because that can be a really big barrier of applying to PA school because, sometimes it's just, you're too busy just on your own trying to graduate from, your undergraduate degree that, it's kind of hard to find time to get those hours. And so that's a very common worry, and I want to reassure you, you are not alone in having that concern. And there truly is no perfect answer to this because there isn't a specific requirement all PA schools have that they would prefer you to be, a certified medical assistant or a patient care tech versus a home aide. Some schools will actually list on their website like a PDF file of things they consider to be of high quality patient care and they would prefer you have because those are the situations where you're having the most patient interactions. So if you are seeing patients, you're the one who are, you're taking their history, maybe you're giving them their flu shot, or you are the one that's assisting your provider in a minor surgery. That comes with a lot of hands-on experience and that looks very favorably. Whereas, someone who is mostly just sitting in the back taking phone calls or, making appointments, that's not really seen as patient care because you're not having that patient interaction. And you'll see within PA school as well, there is a lot of variety of what people consider to be patient care hours. Like I said, I worked as a medical assistant, but some people I know worked in hospitals in the ER or EMTs. It just truly depends. So there's no overlying specific answer, which I know is really frustrating to hear that. But I would start out just starting in general, you're already halfway there. So getting that first foot in the door by, being, maybe like a part-time medical assistant. Maybe then you can apply to a job that's full-time and has more patient care requirements. So I know that first hill is a little hard to get over because you have to apply to a job that will let you have the hours that you will with your schooling. But any experience is better than no experience at all, and it will all become relevant, when you are writing your resume or having interviews with schools because they will see that you had the motivation to start early. You've wanted to become a PA since so and so years, so you first tried by getting this job with this practice. So I think the motivation to become a PA, showing that early on is really important. So hopefully, looking up jobs in your area that's a bit more flexible with students will help you out a little bit. But I'm sorry that there's no specific answer.
Okay. Next question. How early should one start preparing their application for a PA school?
Um, so I'm so sorry. I wish I could have a specific answer for all of these. But starting an application, it's never too early to start in terms of, what you might want to write for your application, like your essay, like your personal statement. You can start brainstorming for that right away. There's nothing that needs to be formal about it, but you can always start on that early. And typically what you'll do is if you are hoping to apply to PA school, you'll notice that CASPA that essentially what the Common App is for undergraduate programs. That opens up, I believe, end of May typically. So the application opens up at that point. So that's when you can start filling out, your resume or those sending out those requests for recommendation letters. And that process will go on until I think normally typically closes at the very end of the summer. And so prior to that, I know people will prep for their personal statement or the GRE or other standardized tests from the very beginning of the year, or some people even start prepping, months before that as well. It just depends on the person because sometimes people will push back starting on the application depending on their patient care hours. So for me, it was particularly difficult for me to hit that 1,000-hour mark because I had taken a gap year from undergrad, but even then I was really trying to hit that 1,000 hour mark. So I had to delay. I couldn't go straight from undergrad to PA school because I had to work to get that 1,000 hours. So when you feel like you're in a comfortable enough place where you have enough hours, even if it's not 1,000, because maybe your number one top program only needs 750 hours. If you've hit that, that's great. There's nothing to say that you can't go and apply for it right now. I will say a lot of programs do favor patients with a lot of experience because it shows that you've had enough expertise and knowledge when you hit the ground running when PA school starts. So there's no specific requirement of when you should start. It just, you should mentally prepare yourself like, oh, I might need to take a gap year, depending on where I'm in my education, or um, if I just need a couple more months of working. So it's something that you have to plan out yourself depending on where you expect yourself to be when you hit that 1,000-hour mark, where if you need to take a gap year, one or even multiple, because there's nothing wrong with taking multiple gap years as well. I have multiple classmates who are, they have years of experience on me, and they're some of the smartest people I know because they took the time to get those hours and they knew when they felt ready to apply.
All right, awesome. One update I'll give. So, by the way, everyone, I am Kimberly Supre, the founder of Virginia Association of Minority PAs. So the CASPA application opens usually around the end of April.
So sorry.
Um,
It's
yeah,
been a
that's
while.
totally fine. Only 1 month off. And then the other thing to note is that it kind of depends on which PA program you're applying to, because everyone has a different deadline for their application. So that's just one thing to keep in mind. But awesome response. Our next question here. How would you suggest structuring the outline of the personal statement?
Um, Personal statement is pretty, as I'm sure you guys can tell, pretty important because when these PA programs get hundreds and hundreds of applications all across their desk, that is the thing where you can show off, really. That's the part where you take your resume and then make it fluff it up by showing like why it's important and why you want to be PA. Because anyone can say, I want to help people, or, I like science. Those are the common things that um mistakes you want to avoid because anyone can say that, and that doesn't necessarily apply specifically to the PA profession. And so, personal statement wise, you want to make it as unique and personal to you as you can, which I know is easier said than done. And I know there are some services that will try and actually help edit it for you, but they're extremely pricey. And just because they edit it doesn't necessarily mean that it's 100% guarantee that you will get accepted into a program. Um, a lot of undergraduate schools I know have a writing center so that you can always employ those because it's free. You are technically paying for it with your tuition, and they're experts because there are specific I know advisors that actually do that for healthcare level graduate programs, so they know what the programs are looking for and how to make it sound good. So I recommend looking into those because they can help you brainstorm. I know that's what I did when I started out. I was emailing one person back and forth with ideas that I had and drafts, and then they would send it back to me with little pointers so that I could edit it. I sent it to everyone that I knew, like family wise. And also, if you feel comfortable, you can share it with your the people you work with, like the medical provider, the physician, or the PA that you work with, because they honestly offer some of the best advice. And sometimes you need to hear a little harsh advice so you know like what to fix up because you don't want to sound too generic, but you only have so much space. I think it's so many characters that you can fill up to make sell your case of why you want to be PA to these programs. So sometimes having a different set of eyes on it can really help, or just talking it out with someone to brainstorm can help as well. And I know that the other really, really good resource is other healthcare students. I had my essay sent over to a PA student and a medical student, and I think they offered some of the best critiques almost out of everyone because they were the ones in my position not too long ago. So if you have a close friend or someone that you know is in a medical specialty, they can really offer some of the best advice of, just coming up with that first brainstorm idea, or if you just sending, your second or third draft, they can offer some edits to you. And maybe you can find them. I know on social media, some people will advertise those services. Some people do it for free even. So just keeping an eye out for that, looking online can really help with that.
All right, awesome. I will definitely second using free resources and not having to pay for these things. So I'm glad you gave a shout out for that. Next question, one that I love. How much does the GRE matter?
Oh, okay. So this is once again very program dependent. Some schools have stepped away completely from the GRE. I think I don't want to harp on my program too much, but it's just what I'm familiar with. I did take the GRE, but I believe maybe now Shenandoah is no longer requiring it. And you'll start to see, like I said, some of those changes as time goes on. So your number one program right now might require it, but maybe a couple months down the line, they might take away that requirement completely. And I wouldn't say it's the make it or break it case if it's you and another student and they're trying to decide who that last seat is going to. Out of all the things on your application, they are not going to look at your GRE and use that as the defining factor of who deserves that seat more. It does not come down to the GRE at all. No one talks about the GRE score once you get into PA school. I don't remember it coming up in my interview at all, them asking me about it. It was more so a box for me to check because I knew it was a requirement for me to apply to a lot of these schools. So a lot of people because they don't want to limit themselves to the PA programs that do require it, they will take it. Other people, hate standardized testing. And I know some people said, I will not be applying to any schools with that GRE requirement. So it's a kind of a case by case scenario and how you personally feel. Because, not only is it, mentally taxing because you are studying for a test. And I know, it's been a while since some of us looked at geometry and things like that. But at the same time, it's a financial commitment as well because you have to pay to take it, and you might have to pay to get some textbooks or some online resources for it. So it's a bit of a commitment in that aspect as well. So if you are on the fence about like, oh, I really don't know if I can commit to that, I wouldn't, I don't blame you in the slightest. But I also wouldn't want you to limit your options just because of the GRE. If your number one top, like two schools even have GRE, I wouldn't be like, well, I guess they're no longer my top two. I wouldn't have that mindset either because if there's a program that's really calling to you, don't let the GRE stop you. A lot of schools will require, I think, a score of like 300. And I know some people that studied, maybe like 2, 3 months and they were able to hit that. So I just recommend practice tests if you're worried about making that requirement. So that's another factor that goes into you of deciding when to apply because you don't want to apply within a month of CASPA opening because what if you have to retake it and you didn't account for that time in your application timeline. So making sure you have that done at the right time to make sure that you are getting that score sent over to CASPA and the schools aligns with you because once again, another financial reason is because you have to pay every single time you want to send the GRE score to a different school. So the finances from applying kind of add up a little bit. So just keep all that in mind because that's not something you initially think about when you're just saying, oh, I'll take the test. So depends on the person, but also depends on the program as well.
All right, awesome. Next question. What do we have here? We have a lot of questions for you, Esther. So maybe
Yeah,
we get
no,
we
that's
have
fine. I'm sorry,
2, 3,
guys.
4,
I'm trying to keep my
5.
answers
We
short,
have
but
5. Let's see. Okay. So, would you recommend doing research in the undergraduate years? This person is a biochem major, and at the moment, they were wondering if it's worth it.
honestly, good for you. I'm so proud of you for, even considering it. Sorry, research is not for me, I will say. So that's another one of those things that can go into your resume to like kind of boost it up because I'm sure you can tell that's not a common thing that everyone has. To say that they've had research experience, they've worked with these professors, and you're going to this really big goal of, for this one study. So that's definitely a plus in your application. And that's something you can always bring up in interviews to make yourself stand out or even bring into your personal statement. I personally don't know a lot of PA students in my cohort, just speaking from my personal experience who had research experience. But for the few that I know that do have it, it does, they sometimes bring it back. I know even two students just this week were telling me about their research experience because it helped them when we were talking about things in class for exam week, and applying concepts. But in terms of like a make it or break it, if it's too much of a time commitment for you, it's not something that I would consider that, if I don't do research, I'm not going to get into PA school. Or if I do research, I'm guaranteed a spot. It's nothing to that degree. If it's truly something the subject is you're passionate about, and you want to pursue it regardless of PA school, go for it. Because, it also look good on your resume. And, PAs are in research, it's not unheard of. We are publishing papers, there's conferences, and presentations. So that's something you can always bring into your interview as well, saying, I want to be a PA and I want to go into research. So that's a unique defining factor about you. But if it's too much of a time commitment and something that you're stressed about and you can't even keep up with classes, I wouldn't, you know, beat yourself up for not taking that opportunity.
All right. So we do have a second part of this with panelists, but we're still waiting on a few of our panelists to join us. So we are going to continue with Esther
Okay, I'm
answering
ready.
some questions. You're okay, Esther? You're doing a
No, I'm
great
good.
job.
I'm just sorry you guys are hearing my voice too much. I hope I'm able to answer some of these questions okay.
It's going well. All right. So let's see. What was your personal experience with taking a gap year, and would you say that it affected your acceptances to schools?
I love my gap year. I think it was the best year of my life. I was really hesitant about taking a gap year when I first uh considered PA school because I was like, why do I have to take a gap year? I don't want to waste a year of not doing anything when I could just become a PA faster. And I think a lot of people have that mindset that they just want to go straight in because, what are you going to do with that extra year of time? But within that 1 year of time, not only did, I get to my 1,000 hour requirement, so I was a stronger candidate for a lot of these programs. But I also, saved up a lot of money, and that money went into my tuition, and that's still helping me out to this day, so that I was able to not take out as many loans. And, that's always a plus for a lot of people. And even though something as benign as working as an MA in a derm office doesn't seem like, a really big clinical patient care experience compared to some of my other friends who literally worked in like really big hospital institutions and ERs. Just those little experiences I've had with patients helped me a lot, when, I had to do a test with a standardized patient and I'm trying to talk in patient-friendly language. I already had experience in that, or even just recognizing medications that I would see rooming patients, or um, helping my provider with certain minor procedures. I had an opportunity to get more of those experiences because I took that gap year. And that's not something everyone can easily come by because I know some people in my cohort who went straight from undergrad to graduate school, they only worked for maybe about 6 months or so. And they were, not necessarily behind, but they weren't as familiar with us as who've worked a little bit longer. And there's nothing wrong with that because you all start the same baseline when you start PA school regardless. But if you're someone who feels the need to or wants to have more experience or background knowledge about the healthcare field, taking a gap year is not necessarily a bad thing because you get to take a mini break because finishing 4 years of undergrad is a big undertaking. You get to save money, more experience, and after all that, it's helping the ultimate goal of you getting into PA school because the more hours you have, it doesn't hurt you. It's going to help you because you stand out among a lot of applicants. So don't let that be a deterring factor for you. Or if you want to, apply twice, let's say you want to say, let's see where I get with just my first year applying and try second year. There's nothing wrong against that. Just be aware that you might have to get different recommendation letters, or you might have to adjust your personal statement because you can't use the same statement twice if you're applying a second time. So just keep that in mind. But I don't want to have the gap year be a bad stigma because I would do it again if I could.
All right, awesome. Great work. You answered a lot of questions. Thank you
Yeah,
so much.
of
I am
course.
now I'm now going to turn it over to Dominique for some announcements.
Awesome. Hi, everyone. I am the student representative for the Virginia Association of Minority of PAs. So very nice to meet everyone and also awesome to see A lot of students from my program and pre-PAs and other PA students here this evening. Just a quick announcement that I just wanted to relay again that Shola, our president, shared with you all at the beginning of this webinar is that if you are not a member of the Virginia Association of Minority PAs, please join if you are a PA student or a pre-PA. You can join for free, and you can do that by going to the website vampas.org. So V as in Victor, A, M as in Mary, PAS.org. Go to the tab About Us, then click on Membership Categories. And then under the pre-PA or PA student, you can click Sign Up to join now. My hope is that by the end of the year, I can reach out to all the current members, so pre-PA students and PA students, just reach out to you all via email to potentially set up either like a Zoom meeting or a Google Meet for a meet and greet, just to get to know you all some more throughout this academic year that I'll be serving as the student rep. But I also wanted to give a shout out to Esther for an amazing presentation and also for addressing everyone's questions. You did an incredible job. And a few things that I wanted to quickly answer before we transition into the student panel and I cue back over to Esther is Bryce just wanted it to just be relayed out to everyone. He said it's not a question, but he said for anyone looking for cheap GRE materials to check out Greg Matt. He has a website with a ton of lecture videos and practice assignments. And yes, I can repeat the link. Yes, yes, yes. So yeah, so check that out if you are interested in taking the GRE. The website again is Vampas, V as in Victor, A as in Apple, M as in Mary, P as in PA, A as in Association, S as in Sally.org, vampas.org for the student that needed that website again. And again, just click on About Us, membership categories, and then under the pre-PA, PA student, you can click sign up to join now. And then there's one additional question that says, and I can quickly answer this before we move into the full student panel. It says, should I apply to PA school during my third or fourth year of college if I meet the requirements by then? Would I be able to apply both years, or will that hinder my chances the second time? Great question. So typically, one of the requirements for PA school is that you do have your bachelor's degree. That is one of the main requirements. And so what is typically recommended is if you were to apply in junior year, that may be a little bit too early. And so usually the start of like, well, April, I think it's the end of April, the last Thursday in April is when CASPA opens up the PA school applications for the next academic year. And so if you apply your last year, so your senior year, like that April, then that'll get you prepared to start that PA program once you graduate from your undergraduate program. And so I would recommend applying your fourth year and then maybe starting to get your application ready, now or second year, third year by getting that healthcare experience, getting those patient care hours if you can. But yeah, I think that's the main thing is like they want to be able to see that you have that degree, even if it's in progress, that you're working toward it. They want like that's a requirement that you have that bachelor's degree prior to matriculating into PA school. So I would recommend fourth year. I hope that answers your question, Kaylee. Awesome. So yeah, so that should be it. And I'll turn it back over to Esther to start the next section.
Alrighty, so I'm just going to go ahead and transition over to the Q&A panel so you guys can continue asking. You guys have been asking some really good questions, and I'm sure there's other questions that you guys might have about your personal experiences or just in general about the application process. And, I am, I can try and help, but there's also many very just as qualified people on this webinar that can answer your questions, and they might relate to your personal experiences a lot more than me. And I've been talking too much, so these people deserve to also talk, and so you can hear from them as well. So I'm going to go ahead and introduce our panelists so that you guys can see and hear who's going to be answering your questions for the next hour or so. And I'm sorry in advance if I'm butchering anyone's names. I'm going to try my hardest here to read with all the correct pronunciations. Okay, so on the call here we have Fritz Batelier, and he is a first-year PA student at Eastern Virginia Medical School, and he was originally from California, and now he is here in Norfolk at school for PA school. Prior to the pandemic, he's worked as an accountant, and then he switched to working full-time as an emergency medical technician and certified phlebotomist technician to help get those requirements for PA school. In the process, he's acquired other degrees, 2 associate degrees in general sciences and nutrition and dietitians, I think, at Santa Monica College, and he's also completed his bachelor's degree at UCLA. For EVMS, he is the treasurer for his class and the student representative for the Virginia Academy of PAs, and he's also the PA liaison for their health outreach partnership in Norfolk. He has a strong desire to continue to serve underserved populations, never forgetting his roots and remembering that his family benefited from clinics like these back home. Also on the call, we have Donica. I'm so sorry, Donica. This is Okpalike. She's also from Shenandoah University, so she's a third-year student, so she's currently on clinical rotations. So she can answer any questions geared towards that area because I'm still in my didactic, so she'll be a lot more familiar with that specific aspects. She was born in Bangalore, India, and immigrated to the US at a young age. After receiving her Bachelor of Science in Health Sciences, she was accepted into Teach for America program and taught elementary school for 3 years before she transitioned to full-time patient care with a local public health department. She's excited to represent non-traditional students and bring a unique perspective to the table. Also, you guys just heard from Dominique Tarrant. She is a second-year PA student at the University of Lynchburg PA program, where she serves as the diversity chair for the Holloway Student Society. She holds a degree in biomedical sciences and a Master of Public Health from Liberty University. As a student representative for the Virginia Minority Association of PAs, which, is the organization you guys are all here for tonight, she is passionate about advertising diversity, equity, and inclusion in her program and overall the broader Virginia PA community. And lastly on the call, we have Paras Rogers. She is a first-year PA student attending South University Richmond. She attended Towson University, where she earned her Bachelor of Science degree in biology with a concentration in functional biology of animals and a minor in public health. She's a former medical assistant that worked in pain management and also OB/GYN. She currently has interest in working family medicine, women's health, and urgent care after PA school. She's currently a member of multiple organizations like VAPA, so the Virginia Association of PAs, AAPA, as I mentioned earlier, and also VAMPA, and NSBAPA. In her free time, she likes to create content, mentor pre-PAs, dance, travel, and try new foods with friends and family. So I'll give it away to all the panelists. I'll hop on if needed, but you guys can go ahead and ask the questions like you've been asking, and they will be more than happy to answer your questions for you. I am so sorry, guys. I just lost the window of my questions I was supposed to ask them. I am so sorry. Um, so to the PA student panel, could you guys describe a day in the life as a PA student?
I can start. Hi, everyone. My name is Donica Pape, PA student at Shenandoah, like you heard. The day in the life of a PA student really depends on where you're at in your journey, I think. The the day in the life has looked different for me all throughout didactic. I'm in clinicals right now at my emergency medicine rotation, you can tell. And I think currently not working too early in the day, my day tends to look like waking up, trying to get some movement in, kind of center myself. For me, that's connecting with, my spirituality, my faith, and then going about getting ready for the day. I like to listen to podcasts on my commute into my rotation, to prepare for anything, whatever the rotation is. So currently emergency medicine, like I said, mostly review questions. It's also a good time for me to be reviewing things that might come up on my EOR exam. So that's kind of what I do. And then emergency medicine is a 12-hour shift. And so I'm pretty much here from 10 to 10 or 1 to 1, depending on the day. And then after that, I don't know. I think I make it home and I go to sleep. It's just all a blur for the rest of the day for the most part. But that's my emergency medicine kind of day in life.
Hi guys, my name is Paris. Like Esther said, I'm a first year PA student at South University Richmond. So I'm still in my didactic year, and for me, my day typically starts at like maybe 6:37 in the morning, where I'm waking up, getting ready, eating breakfast. Depending on if I have an exam that day, we usually have our exams from 8 a.m. to 10. So I will study beforehand, either at the library at my school, or I'll study at my apartment. And then I will take any exams I have. And then after that, we usually have lectures. So we have like a 1 hour break for lunch, but we'll have a lecture maybe like 10 to 12. And then we'll have class from like 1 to 3 or 1 to 4, depending on what lectures we're going through. And like if we have any professors that are coming in from different specialties or different like pharmacists or other realms that we may be learning about that day. And then after that, didactic year is literally studying all the time. So after class, I'm going home or I'm staying at school and I'm studying with friends. We're working through anything that we may have gone through that day, or we're studying for our next exam. So it's just literally studying all the time until I go to sleep, or, unless I like feel like I know what I need to know for that day, then I'll like eat dinner. Of course, I always eat dinner, but I'll eat dinner and then I will finish off my day with like reading a book or something to like wind down before going to bed. So yeah, that's about my day.
My day is very similar to yours as well. I'm Fritz, if you know. I'm on my third semester of my first year of PA school, and so it's structured very similar, where we usually have class from around 9 a.m. to 10 a.m. until like around noon. We have an hour lunch break, and then we have another class from like 1 to 3 or 1 to 4, depending on the class. And our classes right now that we're taking consist of clinical medicine, which is basically the core for like our PA didactic program. So it's like all the diseases, all of the disorders, everything that we need to learn from like all the way until like assessment and plan and treatment. And then another class that we would have to take would be like pharmacology, where we learn about the medications, more specifically like the dosages and the routes for the medications that we give for the things that we learn in clinical medicine. And two other classes that we're taking right now is medical diagnostics and imaging. So this is where we learn how to, for example, we just finished our cardio module. So we were learning how to do EKGs and how to read them, how to interpret them. And it's pretty cool if you're in a program where it's like in clinical medicine, we're learning about cardiology, but in pharmacology, we're learning about the drugs that we would use to treat like the like heart attacks, for example. And then in MIDI, the medical diagnostic class, we're learning about how to read the EKGs. So it's like it's all like revolving, and you're kind of learning the same thing over and over again, but like a different perspective. So I really, really like that. And so that's usually my day from like 9 in the morning until like 4 or 5 in the afternoon. Today was special because we had like a workshop from 4 to 6, where we learned how to do ultrasounds on for basically OB-GYN. So we learn how to interpret how to like age like a fetus, for example, if it's like over 20 weeks. That was pretty cool. And usually on Thursdays for me right now, I would be volunteering at the Hopes Clinic, which is like a student-run free clinic that we have for uninsured patients and underserved patients. And I'm usually there until like 8 to 9:30. But because I'm doing this, I'm not there today, but it's okay. UVMS has like a requirement for volunteer hours that you're supposed to do at least 40 hours by the time you finish your program, because we're committed to like, underserved and serving the underserved. But I'm already at 140 hours and it's only been 9 months. So I really enjoy what I'm doing and I do it every week. So yeah, that's a regular day for me.
Awesome. So, similar to Donica, I'm also in my clinical year as well. Again, Dominique, nice to meet y'all. So a typical overview of clinical year kind of varies, just like Donica was saying, per rotation, and then also too, like whether you're inpatient or outpatient. And so my rotation that I'm currently on right now is in general surgery. So I have very early mornings, but I'm able to get out at a decent time. And so typically my day starts, and this is really early, 4:30 to 5 a.m. in the morning. I typically like to wake up that early just to get myself prepared. I also like to study in the mornings. I'm an early morning studier, and so trying to get that early morning studying in the out of the way is very helpful for me. Also, just like looking at notes because typically what I do the night before, the evening before, like I get off for the day, is I look up the patients for the following day if I know the schedule ahead of time. And I look up those patients, essentially what conditions they have, so that way I can, get to the clinic a little bit later, since I'm kind of in a mix of being in the clinic right now and then in the OR. And so that's typically what I do. And then about around like, I want to say like 8 a.m. to 8:30 a.m., depending upon when my preceptor gets there. I meet with my preceptor. We kind of go over the patients for the day. They'll usually let me go in and see the patient on my own, depending upon which preceptor I'm with. And then I'll come back, report to my preceptor, and then we'll go in together, and then kind of close out the patient. And so what that looks like is in clinic, that looks like visiting the patients, taking their histories, performing physical exams, and then kind of concluding that, and then reporting back to your preceptor in a full kind of like SOAP note format, just the history of the patient, your physical exam findings, any pertinent diagnostics, and then coming up with a plan and an assessment that you would like to present, and then they kind of give you feedback on whether that's appropriate in range or whether you can add certain things or take away certain things from that. And so that's typically a day for me right now in general surgery outpatient clinic. Afternoons, I usually, around lunchtime, I take that break to recharge. And then in the afternoon, again, depending upon your rotation, you may have scheduled didactic sessions with your preceptor, or hands-on workshops that you do, or you will dive right back into seeing patients again. And so that also includes, again, with seeing patients, depending upon your preceptor, is being able to provide patient education in the room too. And so it kind of varies, depending upon rotation, what you do, whether that's assisting with procedures, whether that's performing them in front of your preceptor, following up on labs. So yeah, so that's basically my day. And then towards the end, I am asked if I have any questions. They provide feedback. I reflect on that feedback, go home, decompress, try to study a little bit again, and then repeat that day all over again. So yeah.
I just wanted to add a quick perspective. I think Donica and Dominique did a really good job at expressing how it's like clinical rotations, and same with everyone else, because didactic looks really different for a lot of PA programs. And I'll make this really quick because I'm not one of the panelists technically on here. But when you guys are looking into PA programs, it's a really good idea to see if they offer their courses in a modular kind of presentation. So my specific program does modules, so we learn things by the body system. So we start with derm, and then it goes into ENT, and then it goes into pulm, and that's on a 5-week basis. So my schedule looks the same throughout the entire semester. It's just the subjects themselves change. And then we'll have a specific exam week to test for all of the classes at once. And for all of, pulm, I'll take a pulm, diagnostics exam and then a poem farm exam for that entire week. So I just finished one of my exam weeks just now. And then, so next week I'll go into we're going into MSK after we just finished hematology and oncology and a couple other subjects. But some PA programs, they don't do modular. They will, because I'm not familiar with this, I'm not too sure. So maybe someone else can speak to it. But the classes don't align with the subjects they're all in. So something that if you are interested in, I would look into the program because it depends on how they present the curriculum to you guys and can affect how your day would be. To my panelists, another question. What made you a successful applicant for PA school? A really hard question.
I can start off. It looks like everybody's brain's kind of spinning right now. So I applied as a non-traditional student. And so there was a question, and I think it was from your student presentation, Esther, where someone had asked, like, how many gap years? I did take several gap years, more than one. Which is fine. But basically, so the difference between traditional and non-traditional. So traditional is when like you graduate straight out of undergrad and then you go right into starting PA school. Non-traditional is where you don't do that. And so what I did was I did graduate with my undergrad degree and then I went straight into my master's in public health, earned that. And then I took about 4 years off, but technically not really. Within that time frame, I did gain clinical experience. And so I was a scribe initially in the local emergency department here where I go to school for a little over a year. And then after that, I also was kind of like an outpatient, but it was inside of a hospital. So they called it ambulatory care. So I was an ambulatory care pediatric technician for about a year as well, where I was able to gain more hands-on experience with doing phlebotomy, with doing gathering vital signs for patients and kind of being that first eye that they see once they make it back, seeing, wellness, illness, different specialties within pediatrics. And then after that, when the pandemic started, I worked for 2.5 years for the Virginia Department of Health and helped out with COVID-19 data surveillance and also with patient education, with calling people who tested positive for COVID, giving them education on isolation guidance, and then also working with the care resource coordinator to kind of help. And so I'm saying all this to say, is diverse life experiences is what helped to make me a successful applicant for PA school. One, because I took that time. Two, got an additional degree. I also did research too. So to the other student that was wondering if research is okay, research is fine. I think PA programs like to see that you have experience in different fields, so healthcare, volunteer work, or even non-medical roles, because that provides unique perspectives that help to enhance your understanding of patient care, which will then they'll be able to see that expressed in your application and then want to bring you forth for an interview. And so I'd say that. Also, strong academic performance is important too. Most PA schools require a minimum of a 3.0 GPA. And then if it's higher than that, then that makes you more of a strong or a more competitive applicant. But I also don't want to discourage you if you don't have a 3.0 GPA, because there are, some programs that, can work with that whole mindset of you being an applicant. So not just looking at your GPA, but also looking at your experiences, also looking at your extracurricular activities. Your letters of recommendation are so important, your personal statement. So there's multiple factors that go into making you a successful applicant. But I would say for me would be the diverse life experience, relevant healthcare experience, personal statement crafted to my journey and the shortcomings that I had to overcome that prove that resiliency to make me a strong applicant, that would make me different, I guess, in their eyes when reviewing the application. So I would say those things are main, and then those letters of support from faculty or supervisors can help strengthen your application too.
I can go next. So like her, I was also a non-traditional applicant. So before I even applied to PA school, I was actually an accountant for about 5 years. So I was doing that career and I didn't really find it fulfilling, but it was a means to an end. And it came to a point where I was basically I was only working so I can help support my mom and my dad because they're both older and I just wanted them to like, take a break and retire. It got to the point when they finally hit retirement that I wanted to choose something that I wanted to do. And because my parents are getting older, I often have to help navigate the healthcare system for them. And going through that process, I learned about the career of either nursing or being a PA. So it was 2019 when I decided to leave my job, leave my career, and I decided to become an EMT and phlebotomist because I wanted to go out there and help people instead of being behind like a computer desk. I still use my accounting skills, so that's why I was nominated to be our class treasurer naturally. And applying to the PA school, I actually used a lot of spreadsheets. So like I know someone asked, I think like, oh, how do you keep track of your hours? How do you keep track of your GPA and all that stuff? So I can just show you real quick. Let me see if I can flip my camera. So like on my computer screen, you can actually see like all the classes that I've taken. Like I had a humble start. I mean, I had a couple D's and C's in there, but if you look at my last couple classes, they're all A's and mostly B's. And so my cumulative last 90 unit GPA was 3.97. So I think that's partially one of the most important parts is that when you're applying to a program, they want to know that you are able to succeed. And how they use that as a measuring stick is how your GPA is. So if you have a higher GPA, that means that you can at least succeed and get through didactic to get to, critical rotations and apply what you learned. So as much as a lot of programs that I applied to were like holistic, overall, they're going to try and pick people that have higher GPAs because it's to them, it's proving that they can actually succeed. And like I thought that PA school was getting into PA school was hard, but I was wrong because like now that I'm in PA school, it's like getting through it and actually getting to the end because it's really difficult. Like honestly, outside of the 4 classes that I'm taking a day, I'm also like studying like for like 8 to 10 hours. So it's like that leaves you about like what 5 to 6 hours of sleep a day. So there is some balance to it, but to answer your question about what made me more successful is also figuring out programs that catered to my strengths. So like, yes, my GPA, like cumulative GPA was only a 3.2. My science GPA was a 3.1. Like that's very low, right? But I picked schools that were more holistic in a sense that they were willing to look at your last 90 units, for example. So I think that's why I was able to get an interview at EVMS because according to my calculation, my last 90 unit GPA was a 3.97, which is highly competitive. And also, I had about 6,000 volunteer hours. And so, as I said earlier, EVMS they really value that in a candidate. So that's another thing. So the worst thing that you could do is apply to a program where you don't even meet the requirements. And what'll happen is you'll send the money, and then you'll get like a few days later a rejection saying, "Oh, we're sorry, we can't accept you or we can't invite you for that because you didn't meet so and so." So it's like very important that you make sure that you even qualify for the schools that you're applying to. And like it also changes a lot because for some schools that I was eligible to apply for during my application year, if I were to reapply the next year, there are some schools where like, oh, my chemistry is now out of date because they changed their requirements. So like in order for me to apply to this program, I would have to take like organic chemistry again, which like that's a no for me because that was really hard. So I picked and chose schools that like would cater to my strengths. And I made sure like with my spreadsheet that like, oh, my GPA meets those requirements. My prerequisites that I said meet those requirements. And honestly, a lot of the programs, they're very selective because a requirement for one class might not fit for another program. So you gotta like pull all your resources together. So like for me, Let me see if I can show you. These are all the schools that I had applied to, and I applied to, I think, about 13 or 14, and I got about 12 rejections. So, um, interestingly enough, when I found out I got all these rejections, I actually had started nursing school. So I was halfway through nursing, an accelerated bachelor's in nursing program when I got the acceptance from EVMS. So I left that program to start this program. So yeah, like do your research, find your strengths. The reason why I applied to those schools also is because I did really well on the Casper. I got the fourth quartile, which is like the highest quartile. So I picked programs that like also took the Casper because like I didn't want to go through that 3 to 4 hour exam for nothing. I wanted to be able to use it for something. So hopefully that helps.
Well, I can go next. So for me, my experience, I graduated from Towson in 2022 and I started at South University in January 2024. So I only took one gap year before I went to school. So it's kind of opposite of the experiences you guys have been hearing. But for me, in order to kind of be more competitive, when I was in my undergrad, I did a lot of different leadership roles, whether it was becoming like the vice president of my sorority or it was being a tour guide in my university. I was doing a lot of things to get involved to make sure that I showed that like I still had that leadership aspect and I could also juggle a lot of different things on top of taking multiple science courses at the same time. So I feel like that showed to admissions that I was capable of, tackling a rigorous course load and staying organized while I would be in PA school because I did that in undergrad. In addition, I also worked as a medical assistant my senior year of college and also throughout my gap year. So I was racking up hours. Of course, like because I only took like one gap year, I didn't rack up more than around 2,000, which I think is pretty good to shoot for if you're trying to take like one gap year and go to school. But even in that experience, I made sure that I like built rapport with my providers that I worked with, my supervisor, so that I could have really strong letters of recommendation because I wanted to make sure that, every aspect of my application really showed different sides of me. So I think it's really important to think about when you choose letter of recommendations, like the people that you choose, they should all kind of show different sides of you. So like my supervisor could show the professional aspect of who I was. The doctor I work with could show the clinical side of me. I chose a nurse practitioner that I floated to so she could show my adaptability, like just being selective about who you choose, because that could definitely strengthen your application. And it could show something that you couldn't write about in a personal statement or you couldn't talk about in I think there's the COVID essay. So, like the different aspects that they have you do, your letter of recommenders could really be a strength that you could use. And also applying early. I know Fritz, you were talking about your spreadsheets, which is amazing. Like I had spreadsheets, but nothing like yours. But applying early is so important. And when you have an organized spreadsheet that you can see, okay, these are the schools I want to apply to, and this is their deadlines, like that helps you to know, like, okay, I want to shoot for this date. For me, that was around the beginning of June to be an competitive applicant. And I think that definitely helped me with schools like mine that starts in January, where they have such an early interview process. So I wanted to make sure that I was kind of keeping afloat with all of those things in an organized way. So that was another thing I did, was just keeping myself organized. So yeah, biggest takeaways, your letter of recommenders could be really a strength if you allow it to be and you are selective about them. Getting your experiences throughout your undergrad if you're still in undergrad, and even during your gap year, just bolstering your application. Don't just kind of not do much. And then staying organized and applying early. I think those were my biggest strengths for my application. Yeah.
I think everyone has covered a lot of the main points. I would definitely echo that applying early is really important. The other thing I would say, so I was traditional but non-traditional, if that makes sense. I went to JMU for undergrad, got a degree in health sciences, and was always pre-PA, which was a track at that university. And so it kind of gave you an idea of classes that you should take if you want to apply to PA school. The thing I think, if I look back at that point in time, that I probably would have done differently is just JMU had a PA program and I was interested in it, but I probably would have started to think earlier about where I want to go to school, whether that's in state or out of the area, and then what I would want in a PA program. What actually ended up happening later on was I kind of vetted the programs I ended up applying to based off of the requirements, like was discussed before. But having a health science degree was nice because a lot of people get degrees in hard science, I say, like biochem, so on and so forth, but health sciences is directly applicable to the larger healthcare system and then the various fields within healthcare. So I took courses in child and adolescent health and geriatric health, took a US healthcare systems course, use and effects of drugs, things like that are a little bit different. And so I think even starting from like choosing your major and doing it something that you're interested in. Now, you don't have to have a science related major to apply to school. You just have to do the prerequisites, but it is really helpful in the long run for you to have like a complete picture. So I think choosing health sciences was the first thing that I really liked in looking back on my journey. Secondly, I did Teach for America after graduating because I wasn't ready to go right into grad school. I was pretty burnt out from undergrad, from being in various leadership positions, holding two jobs while I was there at undergrad. And I think while those experiences were tiring, they're also experiences that later were helpful in my application process because I was able to show a wide variety of interests. Not I did volunteer work in various sectors. I did leadership in various sectors. If your school has a chapter of the Institute for Healthcare Improvement, that is a really awesome, or IHI Open School. That's a really awesome organization that I believe the chapters the chapter started when I was in undergrad at JMU, and hopefully it's still going now. But kind of finding things that balance, I would say, your personal development as a person and then your development as a future provider, and kind of balancing those two things were things that were super helpful. Did you Teach for America? I taught in Southeast DC for 3 years, and then I ended up working in the public health department. And similar to Dominique, I actually was initially hired to be a clinical aide, clinic aide in school health. And so that was a little bit different in terms of patient care experience compared to the types of patient care experience you might typically see. And it aligned for me because I had just gone from working in an elementary school as a teacher to working in an elementary school as a clinic aide. And so, and it was an interesting environment because you end up seeing primary care type of things, right? Like passing their meds for kids that take daily meds, and then you end up seeing emergent things like getting called to the playground for a kid that broke their arm, presumably, or something like that. So again, those like varied experiences I think are super important when a program is considering who they want to fill their 20, 40, 60 seats with. They're trying to think about who are the people that are going to balance this program, right? Who's going to bring a perspective to have some that maybe they haven't experienced it. So it's not a program to have 20 dermatology scribes and nobody who has any experience in anything outside of that. And so just thinking about those things, get creative. I chose to work at the public health department transparently because they paid money. They paid more money than most places. They offered benefits. And at the time I had already lived up with a salary and had expenses that kind of aligned with that. And so just thinking about, you can make it work, whatever it is, as long as you're thinking about your unique situation. And I think the main idea of what everyone has said is try to be as unique to you as possible, try to be as diverse in that as possible, and then try to apply as early as possible. And I think that combination of things will really get you to where you want to be. And I think you said it, Paris, like you made your goal early June. I think it's important to note, like, it's a goal. And so, CASPA only opens at the end of April, and you might think, okay, like I have everything done, but it takes time for people to fill out the recommendations and get those back to you. Things end up taking longer than you anticipate. And so going into CASPA, I know my goal was like, I want to get this done as soon as possible. Like I had already opened in Catholic before that cycle had even started. I was familiar with what everything looked like. So when it came time for the cycle to start, I was able to go in and kind of just put in everything. And transparently, I paid for the transcript service because I went to too many schools and had too much schooling. And I didn't want to wait for the process of having my own work get verified. So, it kind of depends on what able to. Also,
Okay.
I'm sorry if it's loud because I'm the ED. Like, I can't. Can you guys hear the doors? No. Okay.
You're good. We just have a couple more questions here for the panelists, and then, if possible, just gonna ask if you guys could keep your answers just a little bit on the shorter side, because I also want to give time for any of the participants to ask, their own personal questions at the end through the chat. So this particular question is asking for study techniques that worked best for you.
I'll keep this one short and sweet. Stay organized. Very important. Use a planner. I pretty much, that's how I got through didactic year. Everything was color coded by class, keeping track of assignments, exams. Um, that kind of helps you to stay on track so that way you do better. And so there are like some digital tools like apps that you could use to help with that, or you could be old fashioned like me and just get just a regular just planner that will work for you. But I think that's the biggest thing to helping you be the most successful in PA school is just your organization. And if you struggle with that, there are people in your program that can definitely help you with that. Students, faculty, there are some different I know it kind of varies per PA school, but there are some different resources that are available like on campus as well, where they can help you get organized too. But I think that that's the biggest thing is staying organized.
Yeah, I would say for sure staying organized is very true. I second that. Like it's so much material that they're throwing at you. You need to keep up with it somehow. So yeah, I also have my agenda, like you're saying, a planner. Another thing I do, because clinical medicine, I think Fritz was touching on that about it's like the meat of PA school. It's a lot of information. At my program, it's 8 credits, so you can imagine how much material that is. But for me, I make charts. So I'll go to Google Doc and I'll just make charts to put all of the different diagnoses that we learn, like the treatment plan, the symptoms, and even any other pearls that my professors may say to us. And then that'll be my way of studying. So I'll go through all of the material for that organ system that we're learning. And then before the exam, I'll just do Quizlets as well that my classmates make or that I make myself to do some active recall. I think that's another really big thing to do is make sure you're quizzing yourself as you study. And then, yeah, keeping up with your charts. It could also be used for clinicals when you're having to review different things. If you have one place to look for everything, I think that's very helpful to look back on. So those are the biggest things that I do right now for clinical medicine and even like diagnostics and other courses that we take. So, yeah.
I would say for me, it's working smarter, not harder. There's a lot of things that I used to do that was not helpful in being able to actively recall information. I like to rewrite things because I don't know, writing just makes me feel like I remember it. But at the same time, if I, it's not it's not like they're thinking in terms of can you take the information, think about it, and apply it in context, which is what you're doing on exams. And so for me, the biggest thing has been doing practice questions when I've covered the material, and that's really more specific to clinical year, I would say, or even more important in clinical year. I would do it before exams in didactic, but clinicals, you're only taking EOR exams. You don't have anything else that you have to do, and so taking those practice questions and applying that knowledge on a daily basis. In terms of didactic, the thing that I started doing later and was really helpful is looking ahead and preparing ahead of time. And so in a lecture, I'm not a great auditory learner. And so when someone's up there talking at any point, they could lose me. And I have now lost important information and explanations. And so in order to prevent that, looking at the content ahead of time at a high level overview whatever the topic is. Today we're learning in, heme onc, we're learning about chronic lymphoid leukemia. Like I'm going to look that topic up, watch a quick YouTube video on it, just so I have something going into it. This was really helpful for pharmacology because that was not my bread and butter. But I would say, yeah, preview the material to whatever ability you can, or set your notes up, or do something where you've kind of touched that material once before you've stepped in the classroom, and then you can, look at it again, and then you've had, three chances to see it before, the day is up or the week is up.
I think it also just really depends on how you best learn. Like we can give you recommendations on what we do, but it's because it works for us. Like if you're not an auditory learning, but for me, like I'm a kinesthetic learner, right? So it's like I could listen to podcasts, but it won't be as effective as for me. If you look behind me, I have like a whiteboard, and I usually just like start drawing out diseases. So it's like I actually have like heart failure drawn out right behind me. Um, Another thing is, yes, you could be a different learner, but being organized is so helpful. So, like for me, I just have a spreadsheet of all of my classes and all of the assignments that are due and when they're due, so that I can prioritize accordingly. Like, for example, I have an exam on Monday, so I have like 3 to 4 days to really study the material that's going to be on that exam. But then I also have another exam on Tuesday. So it's like, okay, well, I can't just study for one class. I have to study for both classes. So I have to dedicate my weekend and split it accordingly to study and make sure I have enough material, like gone through like many passes of the material just so that I'm prepared for it. So it all depends on you and what works. I've tried Quizlet, I've tried Anki, I've tried just like all these other things. But one cool thing that I've learned is so like it depends on your program. Some programs have like free resources for you. Like we have access to something called Access Medicine. So basically, it's like all of our textbooks are in PDF. It's like a library. So you go to Access Medicine, you find your textbook that you want, and you can download the chapter. So for example, I had like a heart failure chapter, and what I did was I uploaded that chapter into ChatGPT, and I made ChatGPT generate a 30 question exam based off of the material that I had uploaded. So it was asking me questions about concepts that I would learn. The only thing that I would say is to take that for granted because ChatGPT isn't always right. So always like use that as like a resource just to get your like, basis and see what you don't know or what you know. But for me, it's like it's hard for me to invest in like Pants Prep or like Rosh Review because like I'm poor. I don't have that much money because I'm not working anymore. So like these are like kind of cool things I do for free to take advantage of, and it's gotten me through so far. I'm doing pretty well in PS school, so I think it works for me.
All right, next question I feel like is pretty important. Um, but how would you say you prep for PA school interviews?
I prep for my interview by doing a mock interview with an organization called the Physician Assistants of Color, and they offer paid sessions. And I got some really good feedback from one of their team members, Samora, and honestly don't was I just kind of thought like the interview was something that I love talking. I love talking to people, and I viewed the interview opportunity to learn more about the program and an opportunity to share more about myself. They have already determined that you're an eligible candidate for their program, and so the interview is an opportunity for you to sell that and and so my preparation wasn't turn. It was more focused on what what gaps could they have questions about in my application, right? Like low scores at any point, anything missing that you chose not to take, any gaps that you took. And so explaining kind of your journey. And I focused on being able to speak to my journey, being able to back up the things that I said in my personal statement. And I focused on questions that I had about that program or that university so that there was something for us to discuss. Because the interview, as much as the program is interviewing you, you're also interviewing them.
So for me, I would say it's very similar to Donica. Like I did mock interviews, but I actually had a mentor that I had gotten from the National Society of Black PAs or NSBPAs, and she was able to do two mock interviews with me to kind of make sure I, wasn't nervous or I didn't show that I was nervous, and that when I was answering my questions, I was really thoughtful about that. So my main focus when I was doing the mock interviews was definitely like making sure I knew like my strengths and like showing that, and also like making sure I solidified my story because the only thing that changes is the questions that people ask you, but your story never changes. So I always went in knowing like, okay, I know who I am and what I have to offer, but I just need to be able to kind of fit to whatever questions they may have. And then another big tool that I think a lot of people know about is Savannah Perry's interview book. That was very helpful because she has different styles of interviews in her book that she'll talk about. So I think it's very important to at least have some type of resource to read over. And then she had questions at the end that you could pull from. So even me, I also did an interview with my parents who are not in the PA field, they're not even in healthcare, but they were able to ask me questions and give me good feedback based on the book because it did give interviewers tips on things that they should be looking for. So that was another big tool that I use that I think a lot of people still use today, but it's a very great thing if you haven't invested in that to do if you're prepping for interviews for sure. So those are my biggest things.
Yeah, I second the Savannah Perry textbook because that's the basically what I had read. So I had one interview and I interviewed in Virginia and I'm from LA. So I had about like a 10-hour flight from LA to Virginia with like a I had to switch a plane in Texas. And so what I did was I read the entire book right before my interview. So it was basically just like having in my head like responses to those possible questions, like, why do you want to be a PA or why this program? That kind of stuff. So, like you want to have prepared answers for those because if you don't, then it's like it makes you not look so good as a candidate, especially if you're interviewing with a lot of other people. And yeah, and that's something also to take into consideration because a lot of programs they just do interviews over Zoom, so it's like it's fine. And like but for me, like for example, I don't even know what to look at for like eye contact on the Zoom video, for example. But in person, it's like, oh, it matters. Like if you're looking in the corner of a room and you're talking to the person, it's like it's not going to look so good. So like having some mock interviews for that, like that'd be really, really good. But I didn't have an opportunity to do that, so I basically just went in with the textbook. But I did do some research. I had found out that on Savannah Perry's podcast, like one of our associate professors went on her podcast and talked about the program. So I use that as a resource for like, oh, why would I want to go to this school? Well, he mentioned that like we have like a standardized patient program, which is like really, really good. Our ultrasound program is really, really good. So like I focus on those kind of elements during interview. And then on interview day, right before going into my actual interview, I talked to the students that were there, and now they're like my friends, and like they gave me some really good advice, and some of it was like be yourself, or like that kind of sort of thing. So just like read the environment and then see if you actually feel like you can fit in this program. For me, it was an easy choice because it was the only program I got into. But like someone else said, like not only are they interviewing you, but you're also interviewing them. So also have really good questions because at the end of the interview, they're going to ask, "Do you have any questions for me?" So it'd be really good questions that really good to have those questions prepared beforehand.
Awesome. I share very similar sentiments to all the other panelists. I also did some practice mock interviews as well, mainly utilizing friends and family members because it was free. I didn't have to pay any additional money for that, where they could just ask me questions, make up different scenarios, and then I would just kind of work through those because it's really important to on interview day to know the profession. So understanding the role of a PA, the responsibilities of a PA, and the differences like between the PA role with other healthcare providers, because you'll be placed potentially in certain scenarios where you're having to like explain or kind of talk about the role of a PA in that particular scenario. And so staying informed about current trends and challenges in healthcare that may affect PAs is very important too. Another thing as well, is to prepare for common questions. So why do you want to become a PA? Prepare for behavioral questions. So how you've been able to handle challenges, teamwork, conflict. That's very important because again, just like Esther mentioned and a couple of the panelists mentioned, is that spots within PA schools, it's typically 40 to maybe 60 students. It's very tight knit. My PA program consists of 40 students. And so you're having to, work and see the same students every single day. And so it's very important that you can work in a team, but not only in the school system, but like in school and then also just as a PA. And so that's something that my program takes very seriously is just being able to work as a team. Additionally, I would say know the program that you're applying to. So research the school, familiarize yourself with the PA program, its mission, its values, the faculty, and any unique features, and be ready to discuss why you're a good fit for the program. Ask insightful questions. What helped me is I came in already just with a list of questions that I wanted to ask the student panelists. And so that way, my name could kind of get in, the air with the student panelists. So that way, if faculty ever asks, like, how are the students, or is there a student that stood out to you? Like, they would be able to potentially remember me from like a question that I asked. And if there's something that you want to bring forward to the table or an idea that you have, when you get accepted into the pre-A program, implement that if you can. Don't just say it for your interview, but actually do it, because they do like to see that as well. And then also I'd say day of interview, plan your attire ahead of time. Remember to stay calm and collected. And then one thing that I did is right after my interview, I sent a thank you email to the admissions coordinator just out of appreciation for the opportunity, just to reinforce my interest in the program. And a thank you goes a long way. And so I'd say that that is another tip too. That would be helpful.
I'll keep this really short since you guys already did such a really good job of covering like everything that you should consider when you go into interviews. I just want to mention this really quickly because Shenandoah is, very generous in that they allow current PA students to sit in on actual interviews. So I've sat in on a couple helping out the faculty and asking questions and seeing, potential PA students about to enter our program. And like Dominique mentioned, it's so, so, so important to research the program ahead of time. It really shows when you ask the student why they're interested in a program and they say, to be frank, a very generic answer that doesn't really apply to that program, you're kind of less inclined. Like you can tell they didn't really do their research ahead of time. So looking at those unique factors about why that program is so special and stands out to you will make you stand out to the actual program. And looking at questions ahead of time, I kind of like Dominique, I would come in with a certain list of questions that I would always want to ask. And if you show that initiative about caring enough to answer or ask a specific question about their mission statement, it shows that you truly know what you're talking about and you really want that program. So kind of like I mentioned earlier during my presentation, a question I would always ask a program is, I see on your website that you guys really prioritize diversity and that you guys care about representing the patient population. How do you incorporate that into your curriculum? And sometimes you could see the faculty, they wouldn't really know how to answer my question, and that would make me feel a little uncomfortable. Other times, they would go right into like a specific class or a specific experience students have that directly applies to that. So that tells me they know what they're talking about and they actually live up to their mission statement. So just doing your research ahead of time is so, so important. And it shows that you're prepared. And oftentimes, when you get to the interview part, the person you're interviewing with, sometimes they'll tell you they didn't even see your application. And that's intentional because they want to hear it directly from you. So kind of like what Para said, I really, really like her answer of the story never changes. So just find a way to connect it back to your personal statement to make it like your overall theme, because that's the whole reason why you're there. So even if the question doesn't directly apply to it, try and bring it back in. Because that if that's what got you in through the door, your personal statement, you got to bring it up again during the interview somehow. All right, and one more question here. Does anyone have any tips for success in PA school? I think we're all still trying to figure that out, but any general or unique tips that anyone's had from experiences?
I don't think it matters where you go to school or what you did beforehand or whatever. PA school is really difficult. It's like I think Fritz said, the hardest part is not getting in. The hardest part is staying in and graduating. And I think there is a lot of stress and a lot of pressure that comes with actualizing a goal, no matter how long you've had it. And when you get in an environment where there are people who are now, in the same space as you. Some people may be competitive, even though they don't need to anymore. Some people may be anxious because it's a new environment for them. Whatever it may be, you might be that person. Like, take stock of where you're at going into school. Make sure you're ready mentally, like your life and everything else is also set up during school, and do what you need to do to maintain your mental health, because I think that's the thing that tends to suffer the most, and isn't visible on the outside for a lot of people. But yeah, and for me, it was making sure I stopped skipping the gym to do anything else.
Yeah, I'll definitely second what Donica said about like making sure you prioritize your mental health. Like, take breaks. I know that it's very overwhelming with the amount of information that is coming at you. You feel like you can't, like, you feel like I can't stop studying. I feel guilty for studying or for not studying right now. But like, it hurts you if you continue to do something so much to where your brain can't even process the information anymore. So I advise, even if you're not in PA school yet, you're in undergrad or wherever you are, like, try to find things that you know are like going to be hobbies for you, so that even when you are like, I'm tired right now, I can't study, you have something else that can fulfill you and take your brain away from PA school, so that when you're going back to studying, you have more of a fresh mind, because otherwise you will burn out and it is not going to be fun trying to get yourself and pick yourself back up. So just try to figure out some other ways and other hobbies, even people that like are your support system to go to when you feel like you're overwhelmed in PA school, so that you can sustain yourself. That'd be my biggest thing.
I second that. Because for me, moving LA to Norfolk, like I don't know anyone here. Like all my support system is all back home, my friends, my family. So when I moved here, like the only friends that I really, really had were people that were in my program. So it's like 80 people that I just met. And it was like hard to like move here. I didn't have any help moving things in. So like having to do that all by yourself, it's kind of difficult. So my advice is like not only just have friends that are in your program, but also try to find non-PA school friends, because what happens is like when you have only friends in PA school, when you're out of class and you're like trying to go to lunch or get some food, what are we gonna do? We're gonna complain about PA school. So it's just kind of like this a whirlpool of like negativity, because all we're doing is just like, ah, this is so difficult. Why is this so difficult? Or like that exam is hard. So like one of the things that I've been doing is like I've been going to church. So I made some friends through church. And so it's kind of refreshing having a conversation not about PA school. And every Wednesday, I part of the Norfolk Run Club. So we'll go run, and after that, we'll like socialize for a little bit, because like I gotta get my steps in and exercise, because that's another thing that's important, is that like when we're taking exams that are like 2 hour, 3 hour long, especially for like the pants, like if you haven't been working out, like it's not just the mental exhaustion of having to study and take the exam, but you also have to have like the stamina to be able to like be resilient. It's like after like the 100th question that you're asked, like I don't want to do this anymore. Like this is so like difficult, and I don't want to think anymore. But like if you work out and you're doing all that, like you have like more endurance to be able to succeed. That's my advice.
Awesome. Can I third that or third what everybody said? Agreed. 100%. I honestly, you all took the words out of my mouth. So I guess what I'll do is I'll just leave some words of encouragement for those that are on. And so the first thing, just kind of summarizing what we've all talked about, is just remembering to believe in yourself and that you have what it takes to succeed, and to trusting your training, trusting your knowledge and your resilience. Because when challenges arise, it's important to remind yourself that you are capable and prepared. I think secondly, just remembering your why. That's like one of the biggest things that I feel like I always say is just like remembering your why, remembering why you chose this path, remembering why you desire to help others and make a difference in healthcare is powerful. And let that passion, when tough days are hard, fuel you. Like, be your source of encouragement if no one else is. Let that fuel you. And then I would say, again, just celebrating small wins. I think like passing an exam is important. Even if you don't get the grade you want, you passed. That's important. So just acknowledging your achievements, no matter how small, because like each exam passed, every single patient interaction, clinical year, didactic year, when you're doing free clinic hours, just like Fritz was saying, and then my program, we also do free clinic hours and didactic years. So like any patient interaction, didactic year, clinical year, or skill learned, and your diagnosis classes is a step closer to your goal. And so just celebrating those moments. And then just lastly, just keep pushing forward because everybody has this, whether it's, getting through didactic year, getting through clinical year, preparing for the PANCE, whatever stage you're in, all of your hard work will pay off. And just remembering that the world needs compassionate healthcare providers like us. And so just remembering that there's light at the end of the tunnel. And that's all I got.
I think
I'm
that
gonna
was the
jump
last.
back in for 1 second. Sorry, Esther.
You're good.
One thing that I heard over and over again, everyone was talking about like community and that concept of community. For anyone who's already in school or being in a place where you don't have community. I'm not close to really anybody in my class, and it just happened that way because cohorts are different every year, and people are different every year. But my community existed through an online format, through the physician assistants of color, through attending AAPA conferences and meeting people in person, and then through just other connections. Like I met Dominique at Leadership and Advocacy Summit, and then soon after, this organization started. So get involved in something else if your community isn't coming to you naturally or people aren't coming to you naturally in your program. That's okay. Like you're a cohort and that's great, work together, but also you have to get to the end of this journey and you're going to be the person that has to get you there. And so find the community that supports that and hold that onto that, even if they're not like physically present with you. I think that's super important. We don't all have supportive family, friends, cohorts, and so on and so forth. So I just wanted to echo that for anybody who feels.
Thank you guys for answering all those questions. I think that was the last one we had, so I'll turn it back over to Kimberly and Alushula. But thank you guys so much for your experiences, and I hope that provided some answers to everyone's questions.
Thank you to the panelists for joining. This was really an impactful meeting and webinar that we had. And I just kind of want to wrap things up and just also say that VAMPA does provide mentoring for PA students, free PA students. Dominique is my actual PA student mentee, so I'm really proud of the work that she's doing. And also we provide shadowing experiences as well. So pre-PAs that are interested in shadowing opportunities, just send us an email. We'll be happy to help out. And lastly, being a PA for almost 8 years now, I will say that it is very rewarding going to see my patients, working with my colleagues, saving lives, So I commend all of you for going on this path, and I want to let you know that you're going to be happy. At least most of PAs are happy with their jobs or their careers. So again, VAMPA is available for you, and we look forward to working with all of you. So yes, right now it's actually 8:01. I don't know if we have any last minute questions, but otherwise we would be wrapping up. Our email is VAMPAS, VAMPAS @gmail.com. So if you have any questions, want to volunteer with everything we're doing, or want to become members, please send us an email. Check out our website. We'd love to have you. Again, thank you to the attendees. Thank you to the panelists. You guys were awesome. You rocked it. Thank you to our founder. We really appreciate all of you. Thank you once again.
All right. Have a good night, everyone. Thanks for
Bye.
joining.
Thank you. Thank you for having us.
Thank you.